Welcome to The Explainer. Today we're digging into a super common but often misunderstood medical issue, the abdominal hernia. We're going to break down what it is, what causes it, and talk about the incredible revolution in how we fix them.
So let's just jump right in with the big question. Think about it. Every single time you cough or laugh or lift something heavy, you're putting stress on your abdominal wall. It's an amazing part of our bodies, but it's not made of steel. So what actually happens when it finally gives way?
To really get a handle on what a hernia is, you first have to understand the environment where it happens, and it helps to think of your abdomen in a completely new way.
Okay, now this idea of positive pressure is absolutely key. Unlike your chest, which kind of sucks inward, your abdomen is constantly pushing outwards. That's what keeps all your organs safe and sound. But it also means that any little weak spot in that container wall is being tested 24/7.
So, keeping all that internal pressure in mind, let's get a really clear definition of what we're talking about when that container wall finally fails.
Right. So the crucial thing to understand here is that it's not just a bump. It's something from the inside. We're talking intestines or abdominal fat that is literally pushing its way out through a hole or a weak spot in that muscular wall.
And not all hernias are created equal. This progression here shows just how quickly the risks can climb. At first, it might be reducible. You can just push it back in. Annoying, but not terrible. But if it gets stuck, becomes irreducible, the danger goes way up. And then strangulation. That's when the blood supply gets cut off, and believe me, that is a true life-threatening emergency.
Okay, so that's the what. But what about the why? What's causing these weak spots in the first place? Because it's not always about that one time you lifted something that was way too heavy. Really, the causes are a mix of all sorts of things. Some of us are just born with natural weak spots. Places where blood vessels pass through, or for men, the path the testes take during development. For others, these spots show up later in life, maybe from an injury, a past surgery, or just the natural process of aging. Now this is fascinating. This idea completely reframes how we think about hernias. It suggests it's not just a mechanical problem, but maybe a systemic issue with the very building blocks of our body, our collagen. It helps explain why some families are just more prone to them and why a habit like smoking, which messes with collagen, can directly increase your risk.
All right, let's go on a quick tour, shall we? Because where these weak spots show up is what gives each type of hernia its name. It really is all about location, location, location.
Now, you can technically get a hernia in some pretty strange places, but these four right here, they are by far the main players. Groin hernias are the absolute chart toppers, but the others, around the belly button or at an old surgical scar, are really common too. 10 times! That number is just staggering, right? A tenfold difference. And it all comes down to basic anatomy. That inguinal canal, the path the testes travel before birth, creates a natural weak point for life in men that women just don't have in the same way. And get this, even within that one common spot, the groin, there are two totally different types. An indirect one is basically a birth defect. A little passageway that was supposed to close up never did. A direct one, on the other hand, is more like a straightforward blowout of a weakened wall, something that happens over time.
This is such a powerful and definitive statement. Femoral hernias, which are down in the upper thigh and are more common in women, pop through a really narrow, tight little space. This makes the risk of strangulation incredibly high. So the advice isn't watch and wait, it's fix it.
So we know the risks. How do we actually fix these things? Well, the way we do it today is completely different from how it was done for decades. It's been a total revolution.
Okay, this is the perfect way to think about it. The old school suture repair, that's like patching a hole in your jeans by just pulling the edges together and stitching them shut. It puts everything under tension, and it's probably going to rip again. The modern mesh repair is like ironing a super strong patch on the inside of the jeans. It reinforces the whole area without any tension at all. And that brings us to the magic words, tension-free repair. That concept is the absolute cornerstone of modern hernia surgery. By reinforcing the area instead of just pulling it shut, surgeons have basically slashed the rates of hernias coming back. It's a much more durable, long-lasting fix. And this is where high-tech meets that brilliant principle. Using laparoscopic or keyhole surgery, doctors can now place that reinforcing mesh from the inside of the abdominal wall. What does that mean for you? Well, it means tiny incisions, way less pain, and a much, much faster recovery.
All right, before we wrap up, I want to leave you with one last critical idea, and it's one that might actually surprise you. Because when it comes to hernias, bigger is not always worse.
Seriously, this might be one of the most important takeaways from our entire chat. It feels completely backwards, right? But the medical facts are clear. A tiny bulge can be a much bigger emergency than a large one.
So why is that? Well, think of it like this. Imagine a wide mouth jar versus a narrow-necked bottle. It's easy for something to slip in and out of the big jar, no problem. But with that skinny bottle, once something gets squeezed through that narrow opening, the rigid edge makes it almost impossible to get back out. That's a small hernia. It's a perfect trap.
And that kind of brings us full circle, doesn't it? Knowing that even a tiny defect can be a big deal is a pretty good reminder to just pay attention to the signals your body is sending. An ache, a pain, a new bulge. It might be your body's wall telling you something important. Understanding that pressure inside you is the first step to staying ahead of the problem.